There's a lot of talk at the moment as to what in fact pelvic congestion syndrome is, and so I'm going to try and explain very simply what it is and how it should be treated. Pelvic congestion syndrome really affects women more than it affects men, although it is possible for men to get a form of pelvic congestion syndrome. The complexity of pelvic congestion syndrome is really down to the complexity of the female pelvis. The female pelvis has so many organs in it with vital function, whether it's bowel, whether it's bladder, or whether it's the reproductive organs. All of the organs in the female pelvis need a blood supply, obviously to stay alive, and so there's arteries taking blood into the pelvis. There are also veins, therefore, taking blood back out of the pelvis. Just like varicose veins in the legs, when the valves in the pelvic veins fail, blood can fall the wrong way, causing varicose veins in the pelvis. When there are varicose veins in the pelvis, the weight of that blood in those varicose veins can push on any of the pelvic structures, and that can cause problems, and that's what's called pelvic congestion syndrome. If those varicose veins in the pelvis go out into the vulva or vagina, they can end up having varicose veins in the private parts. If varicose veins from the pelvis go into the anus and around the back of the passage, that can cause hemorrhoids. If the pelvic varicose veins stay inside the pelvis and can't be seen from the outside, they can push on the bladder, causing irritable bladder. They can push on the bowel, causing irritable bowel. They can push on the gynecological organs, causing all sorts of pains and discomfort there, especially during sexual intercourse. And also the weight of blood on the floor of the pelvis can cause an aching, particularly at the time of the period. Because pelvic congestion syndrome is basically varicose veins, it means the investigations we need to diagnose it are a duplex ultrasound scan. We need to see the flow in the veins. It's not good enough just to see whether the veins are big or not. Research from the Whiteley clinic shows that the best way of looking for pelvic congestion syndrome is a duplex ultrasound scan performed internally, a thing called transvaginal duplex ultrasound. And what this does is it looks for these veins and it looks for the flow in them. Although the big tests such as CT scanning, MRI or MRV or venography all sound big because they are expensive machines, they actually only show in reality the size of the veins, and research has shown that this is much less accurate than doing an internal duplex ultrasound scan. Pelvic congestion syndrome needs to be diagnosed by experts who are looking for pelvic varicose veins, and it needs to be diagnosed using a transvaginal duplex scan by people who do this regularly. Once we've found the underlying cause, we can then treat it very successfully. Very interestingly, women who've had children before and who have leg varicose veins, 1 in 5 of those people actually have leg varicose veins from pelvic congestion syndrome. And if they don't have the pelvic veins fixed, then they're just going to keep getting their varicose veins back again.